Hello. Continuing this series of informative videos covering necropsy and tissue sample collection from swine, Pharmabasi, as part of our commitment to animal health, has invited a pathologist who is a specialist in swine health to present this specialized technical content in a practical manner, so that you as a veterinarian can be more assertive in diagnosing swine diseases and in making decisions regarding disease control. In today's video, Dr. Marcos Moraes from Embrapa Swine and Poultry will share with us techniques for evaluating and collecting samples from the porcine gastrointestinal system. By the way, if you have not yet watched our previous videos, here is a link to the rest of the series. Dr. Marcos Moraes, the floor is yours. Today we will talk briefly about the diagnosis of enteric diseases in swine. In the lactation phase, when clinical conditions are more frequent, clinical characteristics and macroscopic lesions are very similar among different agents, making clinical and necropsy diagnosis very difficult. In the nursery, growth, and fattening phases, there are some fecal characteristics and other clinical signs which may be visible in clinical and necropsy evaluations that can help in a differential diagnosis. However, in many situations, it is still necessary to resort to laboratory diagnosis. The intestine is the first tissue to suffer the consequences of post-mortem autolysis due to the abundant microbiota present. Therefore, it is very important to collect samples from these tissues immediately after the death of animals, especially for histopathological analysis. For this reason, whenever we are analyzing an enteric disease profile and choose to take samples, we should initially focus on the analysis and collection of the intestinal tissue, postponing the evaluation of other tissues until later. For a correct analysis of the alterations caused by the different diseases, it is important to know the normal baseline of the intestines, such as the coloration of the serous membranes and mucus, the consistency of the contents of the different segments of the intestines, and normal intestinal wall thickness. Knowing how to identify the different segments of the intestines is also very important, because different agents cause their lesions in different locations. To facilitate localization, it is suggested to identify the cecum, this thicker portion with a cul-de-sac shape, which is part of the large intestine. Once the cecum is located, the ileocecal valve is identified, which is the passage from the small intestine to the large intestine. Starting from the cecum, moving back up the small intestine, the first approximately 80 centimeters make up the ileum, where it is possible to more easily observe the Peyer's patches, which are lymphoid tissue and an important part of the immune system. Above the ileum we have the jejunum, the longest part of the intestine, about 12 meters in length. Above the jejunum, comprising the first 80 centimeters of the small intestine from the stomach, we have the duodenum, which is connected to the pancreas. Comprising the large intestine after the cecum, we have the spiral colon, which leads the feces to the rectum. The coloration of the mucus and serous membrane is clear in animals which have been euthanized and exsanguinated. In animals which have died of natural causes and have not been exsanguinated, it becomes more congested. In the ileocecal valve, it is common to see adhered necrotic material, especially in animals in the growth and fattening phases. Observation of the mesenteric lymph nodes is also important, as it may indicate an inflammatory reaction in the intestine. As for the consistency of intestinal contents, in the small intestine the content is watery, in the duodenum and in the beginning of the jejunum, becoming denser as it advances into the ileum. In the cecum, the consistency is softened to pasty. In the colon, it is a thicker paste, and in the rectum, it has the normal consistency of feces. In the large intestine, small nodules 1 to 2 millimeters in size are often found around the serous membrane in normal animals. These are lymphoid aggregates, they are not lesions. In suckling piglets in Brazil, enteritis has been caused primarily by rotavirus, Escherichia coli, Clostridium perfringens type A, Clostridium difficile, and Cystospora suis. Since only Clostridium difficile affects the large intestine, the rest cause lesions in the small intestine, more specifically in the jejunum and ileum. Colibacillosis is more common during the first days of life. The clinical signs include very liquid diarrhea, rapid dehydration, and high mortality. Often piglets are found dead before developing diarrhea. At necropsy, intestinal contents are watery, slightly yellowish, but few alterations to the intestinal loops and mucosa are observed. Rotavirus infections may occur from the second or third day of life, but they are more frequently encountered from the second week on. Aqueous to creamy diarrhea, occasional vomiting, and wasting are observed in affected piglets. In necropsy, the primary characteristic of rotavirus cases, which is most easily observed in the most severe cases, is the reduction of wall thickness in the intestinal loops of the jejunum and ileum due to bilious atrophy. The intestinal wall is very thin and often even transparent. Remains of clotted milk can also be seen in the intestine. Coccidiosis enteritis due to Cysticercospora suis infection affects piglets from the 5th day of life on, being more frequent from the 7th day on. The consistency of feces varies from creamy to pasty. There is usually no mortality, only wasting in the affected piglets. The lesions are located in the jejunum and ileum but are difficult to identify macroscopically. In a few more severe cases, thickening of the mucosa is observed with formation of fibrinous necrotizing membranes. Enteritis caused by Clostridium perfringens type A affects piglets mainly in the first week of life, most often in the first 2 to 3 days, causing creamy to pasty diarrhea. There is no specific macroscopic lesions. However, mild congestion can be observed in the mucosa of the jejunum and ileum. Clostridium difficile infections affect piglets mainly in the first week of life, causing watery to pasty diarrhea, dehydration, and increased abdominal volume. Less common symptoms may include scrotal edema, respiratory difficulty, and sudden death. The lesions occur in the large intestine, predominantly in the colon, and include acute edema of the mesocolon, necrotic or caseous lesions in the mucosa, and in some cases, ascites may also occur. Coccidiosis and rotavirus infections, although less common, may also affect piglets in the early post-weaning phase, with conditions similar to those occurring in lactation. In the early post-weaning stage, the most frequent cause of enteritis is colibacillosis. Outbreaks may occur with very acute clinical signs and high mortality, often with sudden death of some piglets before diarrhea develops, or profuse, very watery diarrhea. In these more acute cases, the necropsy will show a very dehydrated carcass, a stomach full of feed, and marked congestion of the intestinal loops of the jejunum and ileum, which are filled with watery content of clear or slightly bloody coloration. In less severe cases, there is transient yellowish diarrhea of watery to creamy consistency with reduced weight gain and low mortality. In these cases, lesions in the intestine are more subtle, and mild congestion of the intestinal loops may occur. Colibacillosis infections can occur in piglets up to the 90-day age range. Another pathology, enteric salmonellosis, usually caused by Salmonella typhimurium, affects animals mainly in the weaning, growth, and fattening phases. Clinical symptoms include diarrhea, which consistency ranging from watery to creamy with a strong smell. In some more severe cases, the animals become dehydrated quickly. Feces may contain fragments of necrotic tissue and, in rare cases, blood. Necropsy will show lesions primarily in the large intestine, but which may also affect the ileum. The primary lesions are catarrhal or necrotic colitis and typhlitis, with mucosal congestion and thickening, and an increase in colon diameter. In the most severe cases, foci of necrosis can be observed in the mucosa that develop into button-shaped ulcers in chronic cases. In cases of septicemic salmonellosis caused by Salmonella cholerae suis, the latter phase of the disease may include diarrhea, and in those cases, severe necrotic lesions can be observed in the mucosa of the colon and cecum, in addition to septicemia lesions in the liver, lung, and spleen primarily. Proliferative enteropathy, or ileitis, can affect animals from weaning to fattening phases or even breeding animals. Clinical profiles may be acute in the form of hemorrhagic enteritis or chronic, with symptoms including creamy to pasty diarrhea, which may be transient and may contain undigested feed. Lesions occur primarily in the ileum, but may also affect the jejunum, cecum, and colon, and the lesions appear as a thickening of the intestinal mucosa. The flaps of the mucosa are thickened, especially in the chronic form, due to the marked hyperplasia of enterocytes. The serous membranes of the affected areas can develop a cerebroid appearance. In its hemorrhagic form, the thickening is not as apparent, particularly in the most acute cases where live blood and even blood clots are observed in the lumen of the ileum and large intestine. When the bleeding is less intense, a thickening of the mucosa is observed and the intestinal contents have a creamy consistency containing blood. In more severe cases, areas of necrosis with the formation of fibrinous, necrotizing membrane in the ileum can be observed. Another disease that induces hemorrhagic enteritis or bloody diarrhea is swine dysentery, caused by Brachyspira hypodysenteriae. This agent infects and causes lesions only in the large intestine, especially in growth and fattening phase swine. Clinical signs begin with creamy yellowish diarrhea with the presence of mucus in the feces and evolve to bloody diarrhea containing mucus. The presence of mucus in the feces is the primary characteristic. During necropsy, the contents of the large intestine are softened, containing blood and mucus, and adhere to the mucosa. The mucosa is inflamed, thickened, and may be congested. It is common to observe bloody necrotic enteritis in the colon, and in severe cases, gelatinous edema can be found. Another important lesion of the digestive system is the gastric ulcer. This can be caused by multiple factors. It is more frequent in growth and fattening phase swine and is one of the primary causes of sudden death in breeders. Lesions are located in the non-glandular region of the stomach, the esophageal quadrilateral portion. To locate the lesions, the stomach is opened along the major curvature and the quadrilateral is identified. Lesions begin with a thickening of the mucosa called parakeratosis and may progress to the formation of crater-shaped ulcers, which may be localized or diffuse. In severe lesions, blood can be seen inside the stomach and even in the intestine. As most agents are enzootic in farms, in addition to the identification of agents by microbiological or molecular methods, it is necessary to assess the presence of lesions by histopathology. For a complete evaluation of an enteric condition with a differential diagnosis for all of these most common agents, the recommended practice is to collect 4 samples from the small intestine. 2 each from the jejunum and the ileum, plus 2 samples from the large intestine, 1 each from the cecum and the colon for histopathological testing. These samples should be approximately 2 centimeters long. For microbiological tests, collect 2 samples from the small intestine, 1 each from the jejunum and the ileum and 1 from the colon. These should be approximately 10 centimeters in length and tied off at the ends. Samples should be collected from those areas where macroscopic lesions are visible. If lesions are not visible, the sample should be collected at random. If macroscopic alterations are observed in other tissues, include samples of these in formaldehyde for histopathological testing. And in the next video, we will talk about the diseases of porcine nervous systems.